Hey, Bertha Barrett here. On February the 9th, I tested positive for COVID. I debated if I should share because I'm such a private person. And as much as I debated, I felt a strong need to do so. Not only am I a private person, but I'm a woman of faith and I'm really introverted. So it takes a lot for me to talk, believe it or not. But I wanted to do this because I'm hoping that it'll help somebody, be it COVID related or life related. Because one thing, as a woman of faith, I'm very sensitive to my environment, and I'm always looking for the positive, for the good in everything. So what I hope to do is to share some random videos about my experience after being positive for COVID. Let me put a disclaimer out there to say that by no means am I giving any advice, professional medical advice whatsoever. I'm just sharing. So let's back up some. So on February, you can tell it's gonna be real. It's gonna be real quick. So on February the 8th, which was Monday, I got up to go to work, although I wasn't feeling well. And I thought it was just my allergies because I live in Florida and the pollen is high. And when my allergies act up, it makes me feel, illish. So I thought it was my allergies and I went to work. On Friday, when I left the office, I always check my schedule in advance. And my morning schedule was quite full for sessions. But thankfully, when I got to the office on Monday, I had some cancellations. So I only had 2 sessions, 2 clients that I need to see. So I saw my 2 clients safely, of course, because the organization that I work for, they make sure that we all wear masks, including the clients. They check temperatures, all of that. So I saw my 2 clients in my office, their mask on, my mask on. By 12 o'clock, I just wasn't feeling it. So I emailed my director and told her I was going to go home because I wasn't feeling well. She just so happened to pop by my office before she got the email. And she said, "You don't look well." And I explained to her that I wasn't feeling well. And I kept saying it was just my allergies. And she said, "We don't know that." So she said, "What we're going to do is we're going to cancel your appointments for tomorrow too, and you just go home." Now, the whole time I was feeling bad, I remember kept saying to people, this is not COVID related, it's just my allergies. Because in my mind, I am the last person I thought would get COVID. Because I live a pretty boring life. I go to work, I come home. So I rarely go out, and when I do, I always have my mask on, always physically distant. The most I have to deal with sometimes is redirecting clients to pull their mask up over their nose or keeping it to their face instead of pulling away. But that's it. So I Never thought I would get COVID, by no means. I'm also, I need to say too, is that I'm a pretty healthy person. I have absolutely no underlying medical conditions. I'm a vegetarian, been a vegetarian for over 30 some years. I take good care of myself. The only issue I have is some back problems from spinal stenosis. And I manage that well by stretching and exercising. So I don't take a lot of pain pills because I don't like taking medicine. And I manage the back pain. So I have absolutely no medical issues whatsoever. So back February the 9th. So February the 8th, I left the office, came home, and I crashed because I just wasn't feeling well. Woke up Tuesday morning, which was February the 9th, and I felt even worse. So I decided to make an appointment to one of those facilities with same-day testing. My appointment was at 12. I got the results back about 1:45 saying that I was positive for COVID. My husband had to drive me because I was just so weak and didn't feel good. I couldn't drive myself. So when I got the results, I told him I was positive. And he looked at me and said, "Sweetie, do you think I need to go get tested?" And I said, "Of course you need to get tested." So by that time, I had both he and I walk around the house with masks on. He had absolutely no symptoms. Wednesday, February 10th, I made an appointment for him to go to the same facility, get tested. He got tested, and of course, he came back positive. Still, absolutely no symptoms. He was able to eat. He was feeling well. And he said, "Sweetie, I don't have any symptoms. I feel good. I don't get this." So I explained to him that he could be asymptomatic. By this time, I couldn't eat. I still had my smell, my taste. I just couldn't eat. All I could do was drink liquids. So I text my youngest daughter, because she's a physician, and I told her that we both tested positive for COVID. So she do what she always does as my loving baby. She started calling me and my husband to make sure that we were okay. We were breathing good, no temperature, all of that stuff. She called her sister, her older sister who's in Jamaica, and told her sister. So her older sister called her best friend, my Asian baby, and asked her to check in on me and my husband to make sure we were good, to see if we need anything. So Ma was checking in and going to the store safely, of course, and dropping stuff off at the porch and walking away, and then we would go out and pick it up. So by the 14th, my daughter called me to check up on us. She called like morning, before she went to the office, her lunch break, after she left the office, before she went to bed. So she called to check on me, and my back was hurting. I was in a lot of pain. I couldn't sit down. I couldn't lay down. I was just hurting. So she said, "Mom, I'm gonna need you to call EMT and go out to the hospital." So I called them. I went out to the hospital. Doctor came in and told me that because I was coughing so much due to the virus, that I probably inflamed my back. So she gave me some cough medicine, some pain pills, sent me home. So that's the 14th. By the 15th, my husband came in to the TV room where I was sitting and said, "Sweetie, I'm gonna need you to call 911 because I'm in a lot of pain." By then, he wasn't eating as much and he was doing a lot of sleeping, but he was in pain. So I called EMT again, They came out and got my husband. I got a call later on that they were admitting him. So they admitted him to the hospital. So on the 16th, I'm in the house and I was getting short of breath. I walked to the restroom and it would take me a while to come out because I just needed to sit and catch my breath. So my daughter called to check on me. And while she was calling to check on me, Maya was dropping some stuff off on the porch for me. So my daughter asked her to go to Walgreens and get me a post-op, one of the little things you put on your finger to check your oxygen. So Maya went and got that, and dropped it back off, and I checked my oxygen. My oxygen level was at 84. My daughter again said, Mom, call EMT, go to the hospital. Grab your purse, grab your cell phone, grab a charger, have everything ready when they come. Call me when you get there. So I call EMT. This time they're familiar with me by now because they've been to my house 3 times. They asked me what was going on. Only one could come in the house because we have somebody with COVID. Only one of them can come in the house. So he came in, I told him, he said, well, let me check you with my post-op. And he did. And it was off by 1. And by that time it went down to 83. So he's like, yo, we need to get you to the hospital. You can be out there with your husband. They locked up my house for me, turned on the alarm, everything. Put me on oxygen. When I got into the ambulance, took me out to the hospital, and things started happening quick. They were taking x-rays of me, putting IV in my arm, taking blood, did a CT scan, all of that. And I was just so exhausted. All I could remember is this nice doctor coming in the room telling me that they was gonna admit me because they had to get my oxygen levels up. So they admitted me, and I was 2 doors down from my husband. Neither one of us could have any visitors. He got admitted on the 15th. Let's see. By the 18th, they had him off of oxygen. He was doing fine. So by the 20th, they discharged him. By this time, I'm in the bed with an alarm on, the hospital bed, because it took so much for me to get up to even walk to the bathroom. I called one of the nurses in because I needed to go to the restroom, and she walked me to the restroom, and she stood there while I used the restroom. And I thought I was doing good. When they started out, when I got there to the hospital, just a little bit, they had me on 6 liters of oxygen, which is pretty high, and try to keep my oxygen up. And any little thing that I did, it would go down, and it took me a while to recover. So by this time, the young lady helped me to the restroom, and I thought I was doing good because they let my oxygen down just a tad bit. I think they put it down to like 4 or 5. So I used the restroom, and I asked, could I walk over to the sink, washing my hand? And I was standing there washing my hand. And next thing I hear is her calling out my name, saying, Miss Barrett, we got to get you back to the bed. And then all I remember was she was under one arm and another nurse was on another arm. And they were walking me back to my bed because I was falling out, and I didn't even know I was falling out. And they were trying to keep me from hitting the floor. So they got me to the bed. Once they got me to the bed, sweetest things ever. They sat there with me. One of the nurses just rubbed my hand, and they kept asking me if I was okay. And they was trying to get me to take some deep breath because they was trying to get my levels to go back up. So they pushed me back up to 6. They pushed me back up to 6, and they stayed there with me until my oxygen got over 90, like 90, 91, because it had dropped pretty low. One of the nurses said, "Ms. Barrett, we may have to send you to another floor with nurses who specialize just in respiratory so they can give you more attention." Thankfully, they didn't move me because I was really loving the doctors that I had, and all the nurses that were coming in to help me were beautiful. My daughter, like I said, was a physician. She had been calling out to the hospital, checking on me and my husband. She was talking to my husband's doctor. She was talking to mine, and they were keeping her updated on what was going on. So they end up leaving me on the floor. So I end up staying in the hospital from the 16th to the 24th. They finally got me down to 4 liters and sent me home with oxygen on the 4 liters. Within a short period of time, after testing positive for COVID, I'd lost over 10 pounds within a week. The virus had affected over 70% of my lungs. So things happened really quickly. Thankfully, by the time I was discharged from the hospital, my D-dimers, I think, was like 0.78. So I don't have to worry about clotting anymore. The takeaway from this is wear your mask. Please wear your mask. Practice physical distancing. There's a lot of people who refuse to wear masks and complain about their right not to wear a mask. Or they wear the mask and they put it under their nose, just cover their mouth. I think it's selfish, very selfish, if you're one of those people who are talking about your constitutional right not to have to wear a mask because it's inconsiderate of those people around you. Because it's not about taking away your rights. It's about saving lives and preventing people from having to go through this thing. I'm grateful that it could have been worse, but it wasn't. And I'm doing well. And I contribute that to my faith. So please wear your mask, stay safe, take this thing serious. Please take it serious, because whatever it does it quickly. And like I said, I have no medical issues whatsoever, and I absolutely thought I would be the last person to test positive for COVID. I'm home now, thank God, and I'm healing slowly. But I'm already healed. Let me just say that. I'm already healed. That's a takeaway, y'all. Please wear your mask. Take it serious. Understand that this thing causes issues quickly. And there are a lot of people walking around who are refusing to wear masks but have COVID. You can have COVID and have absolutely no symptoms whatsoever. As I explained earlier, my husband tested positive and he had no symptoms. So it's possible to have COVID and have no symptoms. Even if you're going around family members who do not live in your house, just because they family don't mean you should not wear a mask when you go into their house and y'all hang out. if you absolutely do not know that they have tested negative for positive. Love each other enough and care enough to put your mask on, please. Because again, it's about saving lives and for preventing people from having to go through this. Because I wouldn't wish it on anybody. So that's a takeaway. As I said, I'm going to attempt to randomly post some videos about my experience. I'm also going to talk about some other things because I am a mental health professional and I believe in advocating for mental health. As I share, I'll be talking about those things because I've learned quite a bit. So I'm going to get out of here because I think it's time now for me to shut up and chill for a while. But stay safe. Take care of yourself. Grace and peace. God bless you.